Welcome back to See Hear Feel. Today, I am honored to be speaking with Dr. Duje Tadin. Dr. Duje Tadin, PhD, is a neuroscientist renowned for his groundbreaking research in the field of visual perception. He is currently professor and chair, Brain and Cognitive Sciences, and the director of training, Center for Visual Science at the University of Rochester. After obtaining his doctoral degree at Vanderbilt University, Tadin delved into investigating the intricacies of human vision, focusing particularly on perceptual learning and plasticity and how the brain processes visual information and adapts to changing environments. Tadin's contributions have earned him numerous accolades, including prestigious grants and awards, solidifying his reputation as a leading authority in neuroscience. Welcome to Duje.
Thank you, Christine, for this nice introduction. It's good to be here.
Could you first share a personal anecdote?
I teach one course a year on perceptual. There's a couple of things that I like to tell my students that they're usually surprised about. The first one is we take vision and perception for granted. We open our eyes, we see, but it's a really remarkably complicated process. So I ask my students, what's easier, doing complex math or seeing? And usually students just say seeing. But the reality is that I'm holding a smartphone here. This little phone can do almost any math that needs to be done. But things simple as just seeing a face and recognizing that person or recognizing an object is incredibly difficult. About half of our cortex is devoted to visual perception in some shape and form. So this is easy for us, and we take it for granted only because a massive amount of brain power is devoted to just seeing the world around us. Looking at the students' faces, they're often surprised to hear that. Because we think of math as something hard, but it's only hard because our brains are not specialized to do maths. Our brain is specialized to do perception.
In dermatology and dermatopathology, the diagnoses that we make, the decisions that we make on what something is really based on what does it look like? What are we seeing? And if I don't see something, if I miss a certain very important clue to the diagnosis, I end up in the wrong place. And so that's why I think about this a lot. And I actually think that visual perception is hugely complex. And unlike math, which only has one answer, usually, the answer to what is this really when it's a complex amount of visual data is not necessarily so easy to boil down to one thing.
And that's what I like about perception. It is messy. We have eyes that get a picture of the world, but it's a two-dimensional image in our retinas of a three-dimensional world.
Yeah.
The brain has to do a lot of guessing what is actually in front of us. And that's why we have a lot of different visual illusions, because these are all the cases where the strategies that our brain uses fail. The illusions are really an example of showing how the brain does something really well. And in this one rare case, things don't work out. Yes. I was just in DC with my children on a trip, and everybody was taking a picture of the Washington Monument, trying to hold the monument within their fingers in a sort of perspective illusion. Mm-hmm. That's one example of a visual illusion. It's really an illusion that shows the tricks that our brains use to see the world well. We have all these shortcuts. And so the messiness of perception is that. It's also one reason why computer vision systems haven't gotten to be as good as we are, because they haven't learned all the tricks that through evolution that we have.
Yeah. I like you're saying that visual perception is messy. But what horrifies me is when something important like a patient's diagnosis is based on my visual perception of what's going on. I don't want it to be messy. I want to learn how to make it orderly and neat. I have latched on to system 1 and 2 processing because I do think it gives a little bit of order. I'll try to just use system 1 processing for a microscopic slide. I'll just say, what do I think this is? I'm not trying to think, what's the algorithm? What's this clue? What's here? I just look and glance. But before I actually send that case out as this is what I think this microscopic slide shows, I'll look at it another time and think more with system 2 visually and be like, what is that? Are there really 3 things that confirm what's the worst thing? What if it's actually malignant melanoma? And I just totally missed it. Or what if there's more than one thing in the slide? But let me know your thoughts.
Perception is often messy, but our brains are often good at having their cake and eating it. So most of the time, perception is trying to do your best guess, and sometimes there are errors. But there's also ways that we can attain perceptual expertise. Most of us have categories that we're really good at seeing. And that's where it becomes less and less messy, more and more efficient, faster, automatic. And one of the things that we are all experts at is, for example, seeing faces. So we can see a face of somebody, we know immediately who that person is. They could be having a different haircut or wearing a hat. And that's just because we have massive amount of expertise seeing faces. Faces are incredibly important to our social lives and perception. When it comes to faces, you see somebody's face and you don't have to think about, is this Jennifer? Because you just open your eyes, system one, and it's automatic, and you're not very likely to make an error there. Going back to dermatology, when you become an expert, you really go a few levels up than your regular perception. There's a neuroscientist, Isabelle Gauthier, that's really studied this a lot, and she's done a lot of work in people who are bird experts and car experts. There are people that can see like a part of a bumper of a car, and they can tell you exactly which year and model it is.
Wow.
And people that they can see part of a bird and know exactly who that is. Their brains just work differently. There are parts of the brains that become involved in processing of the information you're an expert in, separate from your regular visual processing. So this is having your cake and eating it. You have this messy system that has to deal with a massive amount of information that's highly varied, but all of us have a capacity to become perceptual experts in a limited number of topics. And that literally involves a very different type of the brain. So an expert dermatologist examining a patient, messy is the opposite of what I would think. Going back to system one, when you have high levels of expertise, messiness goes out the window. You become an expert and a master of your domain. And most of us can only do that for one or two areas, not many.
Yeah. System one, an overlearned process. Whatever domain you have done things over and over again. And for us in dermatology, recognize something, the same rash over and over again. That's an overlearned process. And you do have expertise in automatically recognizing it quickly. But the problem is for patients, right? It impacts patients when you're wrong. And you don't know you're wrong because you think that I recognize this. For example, the facial thing is a great example too. Every once in a while, I think we've all had this experience. Every once in a while, usually from far away, not usually up close, you're like, oh, there's Jennifer. And you might even wave at her. And then 1 second later, 2 seconds, maybe 5 minutes later, if you never really got close, you're like, that wasn't Jennifer.
And it's often something like confirmation bias, because if you're waiting for Jennifer, you're more likely to recognize somebody else as Jennifer. And this could very much apply to dermatology as well.
Yes. So, for example, for microscopic slides, what most dermatopathologists will say is, okay, I look at the slide first and then read what the clinician wrote because I don't want to be biased or influenced. So that way, hopefully, I look at the slide and I think it's one thing. And then the dermatologist wrote something that kind of confirms, oh, yeah, like that makes sense.
System one and two, if I want to use that language. If I say I don't like system one and two, is because I don't think I'm as very separate. I think I'm as often interacting. Your prior expectations, it creates a mindset that's more of a top down, which it can then change and redirect the automatic part of the process. A lot of times when we become experts on something, we do this in a very conscious way. When you try to learn how to drive a car, you think a lot about every single step. When you try to learn how to drive a stick shift, there's a lot of steps to think about. At some point, when you become an expert, you become automatic. And I think we talked earlier about it, is there's a difference between two different classes of experts. There are those experts who are really good at doing it, but can't really explain well. And there are those experts who have this extra ability, meta knowledge, that can do both. They can be automatic, but they can tell you exactly what they did.
If you look at statistics on medical error, it might be as high as 30% of patients are affected by medical error across different specialties. You can be doing something for so long, and yet you're going to make mistakes.
Brains are messy. And it's not that just the brains are messy, but patients present in different ways. It really becomes what we call in science classification problem. If you have two categories that have no overlap, you're probably never going to make a mistake. In medicine, we deal with categories where there is overlap.
Yeah.
And that overlap means that no matter how well you do, there will be things that are going to pass through. It's unfortunate, but sometimes very little you can do about it.
That's interesting what you say about classification and categorization.
I also teach something called signal detection theory, which is the way we make yes-no decisions. I usually use medical diagnosis as an example. You can make a false alarm. You can basically tell a patient that they have something, but they don't. Or you can have a miss when they may have something that needs to follow up, but you tell them they're okay.
Yeah.
And in this kind of scenario, what you really want to do is you want to minimize misses at the cost of more false alarms. And then also contrast that with jury trials, where you can still have misses and false alarms, But there, you would rather have a miss, a guilty person go free than a innocent person go to jail.
Mm.
So you're trying to minimize different kinds of errors. So I don't know if I articulate that well, but you can make two kinds of errors. You can essentially have a miss of something, or you can have a false alarms. And I think
Yeah.
in medical diagnosis, you really want to minimize misses.
Okay. That's interesting that you say that because that goes along with what a lot of people believe is our epidemic of overdiagnosis of skin cancer or other cancers too, breast cancer, prostate cancer, because the general sense might be that we'd rather not miss one. We'd rather overcall something, overdiagnose it rather than miss one.
Yeah, but there is a cost to false alarms as well because you're sending
Yes.
people to follow up testing, which may not show up anything at all.
Yes.
So it's a hard decision to make because at some point you have to put a yardstick somewhere, and you're either going to have more misses or more false alarms. It's a hard public health decision to make. Question.
Yes.
Of course, this
Huh.
is getting outside of my knowledge area.
No,
But
I love it. Something for me to think about. Can you talk a little bit about perceptual learning? Anything that's really surprised you?
again, because we take perception for granted, we open the eyes and see, it's easy to forget that even though we have this massive amount of brain real estate that's involved in perception, most of it is not innate. Almost all of it comes through our exposure to the world. The visual diet is so extensive, constant information through your eyes, and you interact with those objects, and the brain is just constantly training itself to see better. There's a
Mm,
lot of studies through development showing a lot of things that babies don't see and adults see. So our brain constantly learning and getting better and better at perception is something that even people in my field in neuroscience sometimes forget because their daily lives, they just open their eyes to see.
mm.
The plasticity part of our perception and how important our visual diet is in training our brains to be efficient at seeing it is something that even I sometimes forget.
What you just said makes sense to me too, because sometimes for a microscopic slide, for example, I can easily take it and show someone else. And sometimes, sad for me, they'll point out, oh, look at this. And they immediately see something that I did not see. As long as I've been doing this, I'll be like, oh, in my head, darn it, I didn't see that.
Of course, everybody's perceptual background experience is different. And that's the beauty of the range of different human experiences that we will see and notice different things. That's the whole point. To me, the second opinion in medicine, people will have different background experience that may allow her to see things that somebody else didn't.
Yeah.
And vice versa. You will see things that somebody else didn't see. And so sometimes getting two eyes on a slide is probably not a bad idea.
Yes, absolutely.
This is because our perception is messy. Going back to the original comment, it's messy. Different people see the world in different ways. Even identical twins, because they're going to have different experiences through their lifetime, are going to see things differently. So to me, that messiness could then be harnessed by having multiple opinions, get a better, more robust
I
set.
love that. Dr. Kahneman's book, Noise, talks about that, differing opinions for the same thing. Even if it's your own internal opinion, your own opinion that changes, the average of those opinions is usually better than just the one, just like what you just said. I'm going to move on to this. What do you think everyone should know about visual perception?
Our brains do so many different things. We have memory, we have emotions, we have decision making, and about half of the brain is involved in you seeing the world. Because humans are visual creatures, primates are visual creatures. This is our predominant sensory systems. It's not the case with all the animals. My dog relies a lot more on a sense of smell than I do. So the fact that there's so much brain power dedicated to something that most of us take for granted is, to me, remarkable. Don't take your visual perception for granted. It's one of the most sophisticated things that our brains do, and it's not easy. And best way to illustrate that is how poor computer vision systems are. They're getting better, but those AI systems are going to need massive amount of resources and massive amount of training to get anywhere close to what humans already do.
Yeah. Awesome. Do you have any final thoughts?
I'm really enjoying this. The fact that somebody who does pathology and dermatology wants to talk to visual scientists. This is the exciting part of the science because we all want to understand how the world around us works, and we all work in our own separate areas. But sometimes the most exciting things happen when people who seemingly have very little in common start talking and realizing that they're working on the same questions from a different perspective.
Yes. Thank you so much for spending time with me. I loved it.
All right, thank you.